Hi, myself Dr. Siddharth Taneja, a senior consultant at Maharaja Agrasen Hospital. Today I'm going to talk about pulmonary arterial hypertension. Pulmonary arterial hypertension is a condition in which the pressure of the arteries that are supplying the heart and the lung becomes inflamed. Basically, what happens is there is a blockage in these arteries which leads to narrowing of these arteries, and because of the narrowing of the arteries, more forces has to be applied by the heart to pump the blood through it. So that is why the hypertension increases, and thus deoxygenation also happens because there is a low flow of blood because of the blockage or the narrowing of the arteries, and thus the pressure of the heart increases. It is a progressive type of a disease, so the it becomes worsen over the period of time, and thus we have to take steps for improving it, and we have to take medications and treatment according to it. So now, you have to understand that the arteries of the lung and the right side of the heart is affected, due to which this hypertension occurs, in which the patient might have shortness of breath and cough. So thing is, there are different type of pulmonary arterial hypertension. One is idiopathic, in which the cause is not known. Second is hereditary. Because of certain conditions, the patient develops hypertension, which is generational. For example, there is a BMR2 gene, BMP-R2 gene mutation, due to which the patient develops a hereditary hypertension. And then there are certain drugs which also compensate in or are involved in development of pulmonary arterial hypertension. Some of the appetite suppressant which are used quite a lot by today's generation, and also can cause pulmonary arterial hypertension. The most common example is fenfluramine, which may have a part in developing of pulmonary arterial hypertension. Then there are connective tissue disorders and HIV infections, congenital heart diseases, liver diseases, which are leading to portal hypertension, which may cause increase in right heart pressure, and thus leading and pulmonary arterial hypertension. Then the symptoms can be shortness of breath. There can be hemoptysis also. Then can be fatigue also. Hemoptysis means मुंह से खून आना, ठीक है ना, तो that is termed as hemoptysis. Then patient will feel lethargic, there will be chest pain, then there will be dizziness and fainting, then can be swelling in the legs also can be there, and ankles and abdomen. Then the bluish color of lips can be there, and skin can also become little bit bluish in the advanced stages. Then diagnosis, how we can diagnose. Then echocardiography is the most common diagnostic tools which is there available, readily available all over the cities and the India, or the world. Then right heart catheterization is a gold standard, which is only done in hospital settings. It cannot be done in locally at any clinic, so that is why echocardiography is the most common tool. Then pulmonary function test can also be done. BQ scanning, mismatch, CT scans, and blood tests, or CTPS, cardiopulmonary angiography can also be done for seeing this. So there are many advanced modalities which are there for diagnosing pulmonary arterial hypertension. Now, there are various medications that are there for treatment of this pulmonary arterial hypertension. Diuretics, oxygen therapy, anticoagulation. Then there are different drugs which acts on the artery walls and helps them to dilate. So there is endothelial 5 receptor antagonist, PGI5 inhibitors, prostacyclins. So all these things are there. So what you have to keep in mind, if you are having shortness of breath which you could not explain, or you are having a sedentary lifestyle, आप बहुत ज़्यादा कहते हैं आपकी एक्टिविटी नहीं है और आपको एकदम से शॉर्टनेस ऑफ ब्रेथ बनती है, तो आप एक बार अपने कंसल्टेंट के पास जाएं, और या फिर चेस्ट फिजिशियन के पास जाएं और उनसे अपना ट्रीटमेंट या इस कंसर्निंग रिगार्डिंग कंसर्न आप उनसे कंसल्टेशन लें. दूसरी बात है कि पेशेंट पीपल हु आर हैविंग इन अनबैलेंस्ड डाइट हैबिट्स और हु आर ओवरवेट, ठीक है ना. Then in those cases also you can develop easily pulmonary arterial hypertension. In many of the athletes also sometimes pulmonary arterial hypertension can be found because of other causes. ठीक है. So active patients activity levels are not always associated with pulmonary arterial hypertension कि मैं तो बहुत एक्टिव हूँ, मैं खूब क्या कहते हैं एक्सरसाइज करता हूँ तो मेरे को नहीं हो सकता. ऐसा नहीं है, आपको pulmonary arterial hypertension बन सकता है. So सेकेंडली जो रिस्क फैक्टर्स हैं जैसे ऑयली फूड खाना, स्मोकिंग करना और ओवरवेट होना और बाकी अदर कनेक्टेड चीज़ें होना, तो उसमें आपको ध्यान और ज़्यादा रखना पड़ेगा. सो प्लीज़ मेंटेन अ एक्टिव लाइफस्टाइल and a healthy lifestyle, healthy diet, so that you have less and less risk factors for developing pulmonary arterial hypertension, and thus take care of yourself and do consult your chest specialist as soon as possible if you are having shortness of breath which cannot be explained by normal factors. Thank you and take care.